Imagine this. Someone grabs a syringe, fills it with just air, and injects it into someone's vein. A few seconds later, the person drops to the floor, dead. Sounds like something out of a movie, right? But here's the big question. Can an air injection actually kill you? And if it can, how does that even happen? Today, we break down everything about the so-called air embolism and whether or not it is real, deadly, or just Hollywood drama. Let's start simple. Your body can handle a lot of stuff, but sometimes it's the smallest things that can do the most damage. And yep, air in your veins is one of them. Now hold up. Not every tiny bubble of air is gonna kill you. Doctors and nurses inject meds and fluids all the time, and yeah, tiny bits of air sometimes sneak in. But it's usually harmless. The body can handle small amounts of air just fine. So, when does it become a real problem? When a large amount of air gets injected into a vein, fast, that's when we've got a real problem. This is called an air embolism, basically a big old bubble of air that travels through your bloodstream. And here's the dangerous part. Your blood vessels are like a road system carrying oxygen to all your organs. But if a big air bubble gets in there, it acts like a roadblock. Blood can't get past it. Oxygen doesn't reach where it needs to go. And if that bubble ends up in the heart, the brain, or the lungs, it can cause a heart attack, stroke, or a pulmonary embolism. And yeah, that can kill someone in minutes. So how much air are we talking about? Experts say it takes around 50 to 100 milliliters of air injected into a vein at once to become deadly. About half a small cup, that's like. Not a lot, but more than just a few tiny bubbles. Now, if air goes into an artery instead of a vein, way more dangerous. Because arteries send blood straight to your brain and heart. So yeah, it's possible to die from an air injection. But it's gotta be a big dose, injected fast, directly into the bloodstream. Now, let's be clear, this kind of thing almost never happens by accident. In hospitals, they're super careful. Before any injection, they always push out air from the syringe, double-check the 4 lines, and make sure everything's clean and tight. But accidents can still happen, especially during surgery when using central lines. In scuba diving accidents, diving to deep then rising to fast can do this. Or in trauma situations like chest injuries. And yeah, there have been criminal cases where someone used an air injection to harm someone else. It's rare, but it's real. So, what happens if someone does get an air embolism? The symptoms can hit fast: dizziness, trouble breathing, chest pain, loss of consciousness, seizures, and in serious cases, death. If doctors catch it quickly, they can try a few things: high-pressure oxygen therapy, changing the patient's position to keep the bubble away from vital organs, supporting the heart and lungs until the air dissolves, but it all depends on how fast they respond and how big the air bubble is. So no, your body won't freak out over 1 or 2 small bubbles. It happens sometimes and the body deals with it. But if someone intentionally injects a large amount of air, or if a mistake happens and a big bubble slips in, that can be deadly. Movies exaggerate it a bit, like 1 tiny puff of air and boom, instant death. That's not totally accurate. It's possible, but not that simple. There needs to be enough air injected the wrong way at the wrong time. So next time you see a nurse flicking the syringe to get air out, just know they're not being dramatic. They're keeping you safe. To sum it up, small air bubbles, usually harmless. Big, fast air injections can be fatal. Drop it in the comments. The key is how much, how fast, and where it goes. If you liked this video, please give it a like and subscribe to the channel so you don't miss future videos. And if there's a weird question that's been stuck in your head, we might make a full video about it next time.